10 key facts to know on non-organic enuresis before taking up questions related to the topic. Fact number 1. Non-organic enuresis is a parasomnia characterized by involuntary or voluntary soiling of clothes by passing urine. Fact number 2. This condition is typically diagnosed if the child is soiling twice a week for at least 3 months and the child is of at least 5 years of developmental age. Fact number 3. The prevalence of non-organic enuresis typically decreases with age from as high as 7 to 10% at age 5 to 1% at age 15. Fact number 4. It is commonly known to affect more boys than girls. It is mostly benign and self-limiting with advancing age of the child. Fact number 5. Non-organic enuresis can be of 3 types. The first type being nocturnal only, also called monosymptomatic enuresis, wherein the child is incontinent mainly during night sleep. The second is the diurnal only type, which is further subdivided into 2 types. The urge incontinence variety due to urge and detrusor instability, and voiding postponement incontinence, which happens due to conscious deterring of micturition till incontinence occurs. The third is the nocturnal and diurnal type, also called the non-monosymptomatic enuresis, having symptoms of both the types described earlier. Fact number 6. Bladder control is a complex process and multiple factors influencing the same include genetic, chemical, neurological, endocrinal, musculoskeletal, medical, cognitive or behavioral factors. Fact number 7. While diagnosing non-organic enuresis, it is important to rule out possible organic conditions precipitating enuresis like structural problems, infectious diseases and medical conditions. Fact number 8. As discussed, this condition is many times self-limiting and benign, but the impact on the emotional and psychological well-being could be significant. Quite commonly, there could be extreme criticality, self-esteem issues, lack of adequate training and poor motivation contributing to maintenance of the behavior. In these scenarios, it is always recommended to work on the motivation and psychoeducation about the condition to both the child and the parent. This is a useful initial step before any active intervention. Fact number 9. A few important behavioral strategies which could be useful are using a star chart for improving motivation and positive reinforcement, where the child would mark dry and wet day and appropriately be complimented for dry days in a predetermined mutually acceptable manner. Behavioral conditioning in the form of making the child develop a routine with multiple cues in the environment like timings, alarms, rituals and emptying of bladder, thereby children learning to have better control on their bladder. Alarm therapy could be useful in children wherein children wear special undergarments which are connected with alarm device which shall ring the moment the child begins to wet, thereby awakening the child. Last and the 10th fact is that in situations where behavioral interventions fail, pharmacological interventions are useful alternatives. The most effective one is desmopressin. Typically, desmopressin is highly effective, but the chance of recurrence in stopping the same is high. The other commonly used drug is imiprimin. Access more information under the relevant tab of non-organic enuresis in the Brain e-course material. If you are learning from our efforts, do subscribe to the channel, and moreover you are welcome to be a fundee and make us keep the program accessible to all.